Okay, welcome to VisionCast Network, where technology and collaboration come together in service to humanity. Today's guest is Dr. Neal Shah. He is trained as a nephrologist with a medical degree and medical background, and he combines allopathic drug treatment with quantum mechanics and the human microbiome. So welcome, Dr. Shah. It's great to meet you.
Very great to meet you, Christian. Thank you for the introduction.
You're very welcome. So tell us a little bit, please, about your journey to where you are now on this fascinating science of healing, quantum physics, and the human biome. So tell us a little bit about how you arrived here.
So I was trained in medical school in India, and I came here for post-graduation in medicine and then did specialization in kidney diseases or nephrology. And during the course of my training, I encountered some health issues and I was trying to find answers. And I went to many different doctors. I tried to research my own things based on whatever research evidence was there. I went to some of the best doctors. I trained at Harvard as well. So I went to some of the best doctors in that network, where I did get symptomatic treatment with pills and I did get a diagnosis, but I did not get a cure. And I
Okay.
always wondered how to heal this completely at its roots. And I
Yes.
could not find solutions through the medicine training which I was given or which was published in research. So that started my journey of trying to identify how some people have been healing such conditions without a scientific explanation. And I
Hmm.
started reading outside of medicine, and I came across human microbiome research, which was very new at that time. So when I dove into human microbiome research, which is the research of microorganisms living within our bodies, I found out that they function most of the human body functioning, which happens compared to our own human genes. For example, the human microbiome contributes 99 times more genes than our own human genes.
Okay.
So there's 99% chance that a disease is related to the human microbiome compared to our genes or aging or any other factors. And when I grew more into the research field of the human microbiome, I found that the human microbiome is something which is regulated within our bodies, which was very fascinating to me because having a gene regulation in the body is not the same as regulating sodium, potassium, or some other chemicals in the body. This is live gene regulation.
So
And
Dr. Shah, will you say a little bit more about that, please?
yes, so for example, if uh, uh, if you take a lot of salt or sodium, we know what chemicals regulate it in the body, and we think it's those chemicals which have the intelligence of regulation. But
Okay.
when it comes to genes of microbes, we observe that the microbiome composition in different body parts is different and unique.
Okay.
So, for example, your gut and my gut microbiome will have some differences.
Yeah.
My gut microbiome is very different from the microbiome in my oral cavity, nasal cavity, skin, or even blood. Even blood has a microbiome.
Okay.
So there is something which regulates its composition. Now, if I give you an antibiotic or a probiotic or any food, it will impact the microbiome, it will shift its balance. But after that, once the pill is stopped, the balance comes back to its
Hmm.
near original state. So that means there is something internally which regulates the microbiome composition. And this is where I was fascinated, but at the same time, I was stuck
Okay.
because I was not able to find the answers of what is regulating our microbiome in the body. And
Okay.
the other important thing is almost every chronic disease is associated with an imbalance in the microbiome.
Hmm.
So, if we can balance it back, or if we can regulate the microbiome, diseases will disappear. And this is where I started my journey into quantum physics. and I found my answers. And I applied this to myself and healed my diseases.
So may I ask you another question, please? I need to catch up. This is fascinating, first of all. So it sounds like the dysregulation of microbiomes, human microbiomes, are responsible for dis-ease. Is this correct?
Yes, I wouldn't say responsible, I would say
Or
associated,
associate
because
a contributor associated
contributing.
with, okay,
Yes.
contributes to. Gotcha. And so the objective, I guess, suppose is then to get to understand and then to create an environment of cooperation within that ecosystem that produces health. Is that kind of like a layman's way of summarizing this?
Yes, there is a certain ecosystem which is needed for healthy functioning.
Okay.
Our microbiome performs almost every important function in the body, right from digestion of our food, extracting nutrients, producing vitamins, neurotransmitters, and other important chemicals, immune system, and other body organs. So
And
it's
so
like
how,
a, yeah.
so I didn't mean to talk over you. How long have we known this? How long has the medical community known this?
The microbiome research is fairly new, I would say, over the last 20 years or so.
Okay.
Uh, and it started with a fascinating experiment where um, there were two mice which were genetically identical, means same
Okay.
DNA, and they were fed the same food. But one of them was kept in a germ-free environment, which means they don't
Okay.
have any microbes inside. The other was kept in a regular environment.
Okay.
And they found that the mice which were in the germ-free environment remained thin and lean after eating the same food, but those which were in a regular environment gained weight.
Okay.
So the genes were same, the mice were same, the food was same, the microbiome was different.
Yeah. As evidenced by the environment that they were in, is this correct?
Correct.
Okay, understood. Thank you. And so this led you to quantum physics. That seems like a so how did that happen? And why quantum physics?
The reason why quantum physics becomes important is because the roots of health and the roots of chronic diseases do not lie within the human body dimension. They lie in higher dimensions beyond our three-dimensional physical body. And to expand to higher dimensions is what quantum physics teaches.
Would you repeat that, please, again? Because I think it's worth having the listeners hear that again. Would you repeat that, please?
Yes, based on the science of quantum physics and human microbiome, it suggests that the roots of health and roots of chronic diseases do not originate within the human body, but at higher dimensions beyond the human body.
Hmm. Hence the quantum field. So the solution is not in the body, it's outside the body, and it's in a field of awareness.
There is a field which I explain in terms of higher dimensions,
Okay.
and the human microbiome acts like an antenna or receiver of that field. So
Ah,
responding to the higher dimensions, and that's how we can address the roots of what affects the microbiome balance by accessing those higher dimensions.
fascinating. So then it sounds like maybe I'm jumping ahead in the discussion here, but it sounds like there's two really important components, and that is the reorganization, rejoining, if you will, of healthy human microbiomes, as well as a vision to access the source of potent power and healing and getting those aligned in ways that produce the desired outcome.
Correct.
Okay,
Yes.
fascinating. So, what have you discovered in your research?
My research has been predominantly about the blood microbiome. So first
Okay,
thing I discovered is that the blood is not free of bacteria. It has a lot of bacteria, but they are not the kind of bacteria we think about as infection causing microorganisms.
okay,
Bacteria which most of us are used to are those which have an internal DNA and an outer cell wall. And it is that
okay.
outer cell wall which we test for in laboratory, and that's what causes the infection. But microbiome refers to bacteria without the cell walls, just the genetic or DNA component.
Okay.
And they do not cause infection. In fact, they perform important healthy functioning of the body. So there is a unique and comprehensive, balanced microbiome in the blood, which probably has important functions it performs. Now, this balance got disturbed in patients with chronic kidney disease, which was my research on.
Okay.
So, shift in the microbiome balance in patients with chronic kidney disease, which tells me that the blood microbiome is also an important component of health and needs to be regulated or balanced. One of the important components of the microbiome is the diversity of it. The
Okay.
more diverse or more rich the microbiome is, the more is the association with health.
Okay.
And the less rich or less diverse, or if we are losing our microbiome, it's more associated with diseases.
Hmm. So it sounds like it's important to maintain robust human microbiomes. Is this correct? Am I stating that
Yeah.
correctly?
Yes.
And so how do we as human beings do that?
That's a very important question. And that's where I started looking at the impact of probiotics or antibiotics and diet on our human microbiome.
Okay.
So you'll find studies where there are certain diets recommended, certain
Yeah.
probiotics advertised and recommended. But when you look at the research, you'll find that they do help the microbiome, but after you stop that pill, the microbiome goes back to its original imbalanced state.
Hmm.
So there is something which is causing the microbiome to become imbalanced again. And that something is not in the physical body, it's at higher dimensions beyond the body.
So it's the thought or focus or vision or imagination. Is that what you're saying?
It's a combination of different things, but yes, our emotions, thoughts, feelings do play an important role.
Understood. Beautiful. So, what was the most surprising thing you've discovered along the way in your journey of bringing this to light, this fascinating information?
The most surprising thing was the fact that I do not need to go to different doctors for different diseases.
Okay.
When when we go to when we understand these higher dimensions, we understand the connecting factor between different diseases. So I had been diagnosed with 3 or 4 different diseases related to my gut, and I was trying to treat all of them separately,
Yeah.
different pills or supplements. But when I worked on balancing my microbiome, everything disappeared by itself. So there is a common connection between different diseases and the microbiome. And if we
Okay.
are able to balance the microbiome, more often than not, diseases will automatically disappear.
Beautiful. So, what is something that the listeners can take away? I've got a couple of more questions for you. Number one, what is something that the listeners can take away about how to begin the process of balancing their microbiome? First, understanding which aspect needs to be adjusted or addressed, if I'm stating that correctly, and what's the best way to go about beginning that process?
So, if someone wants to balance the microbiome, the understanding comes from understanding and accessing higher dimensions. And
Okay.
this is something which I often struggle to explain in a few words or in a few moments because it is something which is not in people's experience. We only see
Yes.
three-dimensional things with our eyes. So
Yes.
to explain the higher dimensions, I had to create certain animated videos, some clips and everything, and explain this in a stepwise fashion, which I've done in
Okay.
my course called Healing Microbiome. And
Beautiful.
then it taught the techniques of how use these higher dimensions to balance the microbiome naturally without depending on pills.
Beautiful. So it sounds like the step number one is being comfortable getting in touch with that higher source of wisdom. And there's some specific tools and techniques that you teach in your course in order to do that. Is that correct?
Yes, and everything is scientific evidence based. So all the uh, higher dimensions are explained scientifically as what exactly they are, what is the relationship of electromagnetism or field of light,
Yes.
sound, water, intention, emotions. Everything is explained in a very systematic and scientific way to see how we can balance the microbiome.
Yes. So as a medical doctor, you understand the importance of scientifically validated research, peer review,
Yes.
et cetera. And what I hear
Mhm.
you saying is that the things that you present have that level of scrutiny, the scientific and medical focus that creates a level of credibility that is stringent.
Yes. I will I will not say to anyone to stop your pills. I will not say
Yep.
anyone to not follow the doctor's advice.
Yep.
These are important things, but be mindful that anything which is in the form of physical treatment to the body is not going to address the roots of diseases.
Yes. Beautiful. And it sounds like you have made a significant difference in your own life by using these tactics, tools, and strategies. So you are leading by example.
Yes, I would not teach this course if I was not able to do it myself.
Understood. And so are you pleased with your results?
Yes, absolutely.
And is this an ongoing process of continuing to become an even better version of yourself?
Always.
Yes. Fascinating. So Neal, how can people get in touch with you?
I have a website which is www.healingmicrobiome.com. I also have an email and a Facebook group. Neal Shah at healingmicrobiome.com is my email. There's a Facebook group by the name of Healing Microbiome. So people can get in touch with me through those avenues. I'm also on LinkedIn, Instagram,
And so will you spell your name for us, please?
Neal, Neal,
Okay. And last name?
Shah Shah.
Beautiful. Thank you.
Krishan, may I ask you a question?
Absolutely.
I saw in your bio about you having a near death experience and that transforming your life.
Yep.
And I was very interested in knowing more.
Yes, it was. I had ITP, led to an aneurysm, coma, and splenectomy,
Hmm.
and then subsequently to systemic lupus, lupus nephritis, lupus vasculitis. So chronic health challenges based on a situation that happened when I was 17 years old. And like you, doctor, power of mind has been instrumental in my healing journey, which is ongoing. It's
Yes.
ongoing. I'm currently reading a book by, when I say reading, it's on Audible, Dr. Peter Attia called
Yes.
Outlive. It's a really fascinating book. I'm all about the medicine 3.0. I was like, yeah, that's where we are right now. So that, those higher dimensions, if you will, and those experiences that I had the fortune of growing through have shaped my view of the world, how I serve people, and what's most important. So,
Yes.
so
I
thank you,
asked this because
thank
I
you for
do
asking
talk
the question.
I do talk about the science of near death experiences also.
Oh, beautiful. Okay, so we have a lot more to talk about. We can do a Vision Cast Network from the other side of the veil. So, what is one last thing, Neal, that you would like to leave the listeners with? Like one last really important thought to consider. What would that be?
I would say that your life is much more than what most people think. And if you're able to meet basic survival needs, you're able to have basic food, clothing, shelter, basic survival needs, then I would encourage you to expand your consciousness to certain higher dimensions where you can fulfill your life's purpose. And if anything is coming in the way, then there is help out there. There is scientific uh, process which helps you basically transform your life that way to serve a certain purpose so that you don't have any regrets later on. And many people I see in hospitals or at older age tend to regret doing or missing something in their life
Yeah.
during their younger years. So while you have it right now, do it. Don't have any regrets.
Beautiful. No regrets. So when
Thank
you've
you.
taken your last breath, no regrets. So get the basics covered and then shift your awareness to that which is unseen, where the source of power lies, and lean into that and let that be your guide so that as you get to the end of your life, you look back with optimism, joy, and a sense of peace. Is that correct?
Yes, I took a 6 month break off my job,
Mm,
unemployed completely, because I didn't want to have any regrets of not doing something like this, of designing a course
yes.
or helping
No,
people educate, so that I don't feel that I had the opportunity and I missed it. So
yes.
no
Wow.
regrets.
That is powerful. Well, Dr. Shaw, thank you so much for visiting. I really appreciate it. And we'll see you around. Take care.
Thank you so much, Christian.